and welcome to CMR TV. My name is Tamsin Deasey-Weinstein and I'm going to be bringing you the AI wave. This week I'll be telling you about the latest developments in the world of AI. Whether you're using it in the boardroom or just want to learn about how to use AI at home, there's something for everyone. I'll be interviewing global leaders who are using AI to change the world, but also local people who are using it in their daily lives. Let's dive in together and ride the AI wave. Hi, and welcome to the AI wave. Today I'm joined by Dr. Scott David. He is an internationally respected medical professional with a practice right here in Grand Cayman, Grand Harbour Medical. Nice to meet you, Dr. David.
Nice to be here.
Can you tell me a little bit about your practice and what you do here? Because you do a bit of a unique field of medicine.
Personally, I'm sort of the longevity guy. I'm board certified in what's called longevity medicine, anti-aging medicine, regenerative medicine. It changes every 5 years. It used to be holistic. And the reality is that we have Grand Harbour Medical, which does general practice. So anything that you have from a medical standpoint, we do pediatrics, we do adult medicine, we do dermatology, we do chronic care medicine. And I generally focus on general medicine as well as anti-aging longevity.
I think I need a bit of that anti-aging. So how did you get into that? Because it's a very specific field.
Yeah. So I was board certified in emergency medicine and trauma. And then I basically had a brain aneurysm and didn't know that was going to happen. And long story short, after the surgery, did very well. I was blessed to be alive. Most people die with that. And my hormones actually went down really, really well.
Wow.
Well, not really, really well, really, really low. And, I got treated. I felt amazing. I said, well, this is something I want to look into. Did 2 years more of advanced training, and now I'm board certified in from the American Academy Anti-Aging Regenerative Medicine.
I had no idea about that.
Yeah.
That's really interesting.
Yeah, so, it was pretty, that whole story is a whole long story. But yeah, that's how I got into it. And then that was 18 years ago. So I've been doing hormone optimization, testosterone therapy for men and women. And then it's just such a growth field. I mean, between AI and just the exponential growth of longevity, it's been big.
That's so interesting to think. Had that event never happened in your life, you may never have changed.
I stayed in emergency medicine. I loved emergency medicine.
Really?
Yeah, gunshots and stabbings. That was my thing.
Hopefully you don't see any of those in Cayman at the moment.
Definitely not.
Very interesting. So just tell me a little bit about the area. So we talked about anti-aging, hormone therapy. What do you see the most of here? What are most of your clients' patients going for?
In the longevity space, because we definitely still high blood pressure, diabetes, all that stuff. But concentrating on the longevity, it's hormone optimization, testosterone replacement, hormone replacement therapy for women, weight loss. And lately, it's been a deeper dive. There's a lot of young people, which is really interesting, doing a deep dive in the longevity space, thinking, what can they do to live a bit longer? Yeah. And one of the things I like to do is I'm a big tech guy, and I do like to always had what I call toys. Yeah. And I'm always bringing new toys, new modalities, new testing. And some of the newest testing I have is completely cutting edge. It's one was just released 2 weeks ago.
Wow.
And I bring it all in. And because I'm licensed in 3 states in America, I can get the stuff from the United States, and then I could bring it here very easily.
Great. So AI is actually one of the main things I wanted to talk to you about today. And obviously AI is quite controversial in the medical field. There's the people who believe it's going to absolutely be an amazing thing for medicine. It's going to eradicate diseases. It's going to make us all live longer and better. And then there's the other people who are absolutely petrified of it. They still want a human to tell them exactly what's going to happen to them. They don't trust AI. So let's start off. I want to go into what you're doing personally, but let's start off with the broader picture first. What would you say to the people who are scared of AI, who don't trust it, who don't want their doctors to be using it?
Sure. Yeah, I mean, so, again, I'll leave defining what AI is and all that fun stuff to you. But the reality is the two populations of people that would be scared. One are, you know, and I always kind of joke, well, the doctors and the nurses and everybody, the administrators, all of those people, you know, locally, yeah, no, don't worry about it because in 3 years there'll be the tsunami will come.
Yeah.
Come out. If you're not using it in any field, it's gonna be a problem.
Yeah.
But as far as patients being scared, I haven't really had too many patients being scared. There's an old, you know, there's a philosopher, Voltaire, and one of his quotes, I actually have it. Somebody needle pointed it, put it on a wall for me. It's, you know, the job of any good doctor is to amuse the patient while nature cures him. Today, it's, well, nature cures him or her, comma, and a.
Yeah.
And the reality is that, you know, it's so fundamentally better than any human that you have to appreciate it. And the reality is that if patients, you know, they do still need somebody to explain the condition. And that's what a doctor should do. And it's also, but it's kind of like if a doctor doesn't maintain a normal amount of studying, you know, with the longevity space, it's not only my job, it's a hobby.
Yeah.
And I tend to listen to too many podcasts and I read too many books. If I had more money, I'd have a sailboat and I wouldn't be as good. So, but the
one day.
yeah. But the reality is with AI in the field this way, it's just like having an absolute second brain.
Yes.
And you're so fast. And some of the programs which we'll talk about, you can't not use them. And it's amazing to me that so many people have no idea. I had a doctor who she's very intelligent. I mean, she's a really good doctor. She literally, this was like 6 weeks ago, asked me, "Hey, you know anything about this Chat GPT thing?"
Really?
I was blown away. I said, "Listen, game's over." I said, "You know, you need to take 6 months off and learn something." You know, and yeah, I was it.
I think the problem is, especially with doctors, they train for so long. It's almost, they feel it's a bit demeaning to then ask questions to ChatGPT or whatever medical tool you use.
Well, to put that to bed, they just did a big study. They did AI medical, AIME, and they did one group of just AI. They did one group with the AIME and the doctor.
Yeah.
Then they did two doctors.
Yeah.
Using Claude or Google, I think. No, Claude or ChatGPT, and then they just used just two doctors by themselves.
Yeah.
Hands down, and they gave them these very difficult cases. Okay, and the cases are I mean, I've never been able to get them. They're really crazy hard. So the reality is the two doctors by themselves, I think they got like 10% or something like that. The doctors using regular AI got maybe 10%, 15% more.
Yeah.
It's kind of like an open book test at that point, right?
Yeah.
The doctor that was using just the partner of AI got, and I don't remember the exact numbers, but let's just say, you know, they got 110 of the 300 questions.
Yeah.
Right? The AI by itself got 160.
Yeah.
The reason why the doctor and the AI did worse, which you would think that shit doesn't make sense, is arrogance.
Yeah.
And they're the same arrogance that you say, "Oh, I trained, I know everything."
Yeah.
The reality is, it's nonsense. One of the facts that is really mind blowing, and we'll segue and then we'll go into that after, is what is AI going to do for us, right? But people don't understand worldwide, right? Medical errors account for 10%.
Yeah.
10%
Yeah.
of death. The guess is about 3 million people per year. Oops, you know, doctor screwed up, or hospital screwed up.
Because we're humans and we make mistakes.
And make a mistake. And the reality is, this isn't the old thing, oh, the computer, garbage in, garbage out. This is, you know, large language models. This is thought processes. Grok 4 now can think. It's better than every PhD on earth.
So they say, yeah. It is. So I'm very much in your field, and the way I explain it to people is LLMs or any AI model that you use is trained on millions and millions and millions of pieces of data, and the computational power is so strong. It's 1,000,000 times faster than any human brain will ever be.
Right.
Humans are trained on a few people, and the human brain works slowly. So how can the human ever be as good as the AI? They can't be. I mean, it's impossible.
Yeah, I mean, you know, two quick examples there are, and I can kind of use two things. One is, doctors are humans, right? So, you know, me, you know, go to work, I go home, I hit the gym, spend time with the wife, and then we binge some show on.
Yeah.
But in between, I listen to a lot of medical podcasts. I listen to a lot of medical books, as well as reading articles almost every day.
Yeah.
Because I just feel it's necessary, and I've always been that way, right?
Yeah.
So a lot of doctors, they've kind of learned their thing, and they're not
And
moving
they
forward.
stop.
They're stopped. Just
Yeah.
as unions do. Lawyers are the same way, and accountants are probably the same way. But you know, you can't compare the use of having this ancillary quick brain, and it's something that, from a patient standpoint, yeah, boy, I tell you, if I had any condition, I would want to do a deep dive on one of the big language models and just say, listen, what are they saying? And I do that with patients. We'll talk about that, but and again, have I been shocked and blown away that oh, well, I guess I'm an idiot? No, but there are one or two little things that pop up, and I go, that's a good thought. It's kind of like having a colleague,
Yeah.
And then I'll tell you about some other interesting things. But as far as the ability, when you use it in a real technical space,
It is amazing. And it, like you say, it doesn't teach you, but it takes you down a different path that you may not have thought of, and it gives you options. So, okay, so let's go into a little bit about how you're using AI within the practice. I know you're using it in two ways. You're using it to be client facing and in ways that will benefit the client, and you're also using it in your back end services, so your administrative running of the actual clinic.
Sure.
So let's talk about the medical aspect first. I know you have some new tech which is called
Intellex DNA.
Yeah.
It's a genomic test, and briefly, it's basically it gives you your whole genetic code, which has been available for a while, and some doctors have used it not only on Ireland but not internationally. I never did, because you would find the gene and you'd say, okay, well, you have this gene which is responsible for an increased risk of dementia. Good luck with that. See you later. This current test is a genomic test, which basically tells me the function of the genes. So if you do have that same dementia gene, this specific thing will give me 6 or 8 actionable items, such that I had somebody the other day came in, did the test, issue with dementia. Well, it turns out that he likes to cold plunge, right? Which is one of those things. He has a gene that will basically suppress the dementia gene. So you want that to be strong. Turns out that gene is activated by heat shock proteins, which is sauna. So actually, he's not harming himself by cold shock.
But it's stopping that gene for...
Yeah, you're better off sitting in a sauna 15 minutes a day, and that's going to activate this gene. That's called epigenetics. In other words, if you have the lung cancer gene and you smoke, yes, smoke itself is dangerous to the lung tissue, but it will activate this gene. So if you say, okay, don't smoke, it's going to be better for your lungs, but it's not going to activate that lung gene either.
Wow.
So it's a huge test. It's insane. It's about 350 pages of your genetic code, which means nothing today until AI knows how to interpret. Then there's a 90-page of what's called SNPs, which are polymorphisms, broken genes. Okay, so if you have a broken gene, it might be broken in a good way or a bad way. So I can either say, okay, well, through CoQ10 and berberine and maybe a statin and sauna, I can activate that gene.
Wow.
Okay, but maybe I want to suppress this gene. So what should I do? Yeah, whatever you do, don't take magnesium, right? And these actionable items, they're not guesses. They are all basically proven with 2 peer-reviewed journals, and it's the real deal. I mean, there's no one who can argue. There's proof, right? So it's fascinating because it gives you precision medicine. And then what I do is I review it all. I make my notes. I take my notes, all of this data, put it into. Presently, I'm using Deep Dive on Claude.
Claude is amazing.
Yeah. And I'm using that. And then what will happen is it'll give me, say, a 6-page summary of what your life should look like in the next 6 months. And then I go through it as your doctor and say, no, that's nonsense. That's nonsense. Oh, you forgot this. You're not that good. But again, I'm still in the game. And then my job is to explain it to the patient.
Yes.
Okay? And now I have some real smart techie people that want the data, and they're going to do their own thing. And I've had one take my stuff, put it in, and come back and say, hey, what do you think about this? And then I'll give my opinion, right?
Which is great.
Yeah.
Which is great in itself, yeah.
So that's the Intellex genomic test. And you can do it for kids too. It's not only, dementia, Parkinson's, heart disease, lung disease, diabetes, thyroid issues, as well as anxiety, depression, ADD, which I completely light up on. And also, there's a whole autism genetic, and it's very interesting. 80% of people that are diagnosed with autism don't have the genetics to substantiate that diagnosis. So it means that these actionable items actually might enhance their ability. So, but they do PANS, PANDA, different learning disabilities from a genetic perspective. So it's really fascinating.
And it's actually giving you the way to control it, which is absolutely
to do an epigenetic enhancement or suppression. And again, is it better than, say, a medication? No, but one of those actionable items might be medicine.
Yeah.
And that's where I'll come in and say, okay, yeah, well, listen, by doing X, Y, and Z, you're going to shape. And then what's cool is, am I able to take 90 pages and say, okay, well, you have this gene and that gene, and how do they work together? And that's the problem with like geriatric patients, old patients. Some doctors will just keep adding medicine, right?
Yeah.
Well, there's not a doctor alive that can tell you, if you're on 20 meds, how they interact with each other. Because it's never been studied.
Yeah.
I can't.
Yeah.
Right? And I've done that with some geriatric patients, and I've removed 4 or 5 of their drugs because they don't do what you think they're going to do, on a cold call.
Yeah.
Then I have something called the dermasensor.
Okay.
They took 100,000 patients with skin lesions, right? They took a dermatologist here, a dermasensor here, and then they did pathology. They actually did the biopsy to get the real diagnosis.
Okay.
So 100,000. Your typical dermatologist in 3 years of training works 2,000 hours a year, excuse me. So you say if they're seeing 3 patients an hour, okay, fine, it's not a problem. So you say, to get to 100,000 patients, that's a seasoned dermatologist.
Yeah.
Well, it turns out this little machine, which is painless, was equal to at start. But they trained it to be, it's AI driven. They trained it to be equal to dermatologists, right? The difference is those dermatologists are not going to get better. Going back for training.
Yeah.
The AI is. So I can do skin screening on painlessly. So we're going to do something locally on the beach, I think, pretty soon, so everybody's half naked. Yeah. And then I could say, okay, here you go. We could find it.
So how does it work? Tell me what you do.
It's called photomodulation.
Okay.
And so what it does is you take a lesion and it has this little, I think of like a Star Wars thing, a little photon thing. It shoots a splaying of a laser into the lesion. It's painless, right? And then it studies how it moves. It can see how it moves based on the sensor. And you do it 5 times, all different locations. It's 1 millimeter spaces. And basically it tells us on a different, so 0, it says monitor, but basically 0 is the likelihood of that being cancer is very close to 0.
Yeah.
Then it gives you a scale 1 to 10. 10 is 60% chance of it being cancer. The 3 main cancers that are in the foray are squamous cell carcinoma, basal cell carcinoma, and melanoma.
Yeah.
And so the reality is it can save that person a biopsy rather than going after. And there are people that, where we live in the sun, people do get cut and cut and cut.
Yeah.
This is the latest and greatest. So
and that's how simple it is.
It's ridiculous.
Wow.
It's amazing.
And you've got that now.
Yeah. I've scanned my whole body.
And you're all clear.
I'm all clear.
That's good. Wow, that is crazy.
Yeah. So, but without the AI, the human eye can't see the way the light goes through the lesion.
Yeah.
That's the cool thing. So it's really, it's the patients that I've used it on have been amazing.
So what results are you seeing from everything already? So the people who've done the Intellect test, what results are you seeing? Are they happy? Or are you seeing things that you would never seen as well?
Well, you know what it is they're blown away. I did mine, and it found 1 or 2 little things that I was like, okay, but it reiterated. I mean, in my family, we have a lot of heart disease, a lot of diabetes. So you say, okay, well, when you ask about family history, you immediately go, yeah, but I don't eat as much as my father.
Yeah.
I exercise more, and my mother smoked, and all these things. You say, so you justify it. This test, I can look in the eye and say, listen, all equal, you're going to develop diabetes, unless we do maybe these things.
Yeah.
And some of them are obvious, lose weight, exercise, that kind of thing. But it reiterates things. I've had patients that fully blown away. They have a 75% chance of becoming demented in their 60s. Okay. So now you say, okay, now I'm going to do these actionable items. What else can I do? And there's not much in the way of treatment. There's a couple of really cool drugs coming down the pike. Okay. One's called TB006. And that's, it's 75% better than placebo. So I can use that drug now if I wanted to. It's a monthly infusion. Very, very expensive. It's like $6,000 a month.
Wow.
It's amazing, right? And so it really is. It's precision medicine. It
Yeah.
tells me, because like for me, I was genuinely concerned about dementia. Right? You get senior moments.
I get them all the time.
Yeah. I mean, we just had this conversation.
Yeah.
So the reality is that I blessedly have no
You've nothing there.
no dementia genes. And I was like, okay, that's great.
That's
right?
good.
But I'm not going to just give up on some of the, nutraceuticals that I might take to enhance memory. Those medications that I use in my practice, part of longevity to enhance memory.
Yeah.
A whole section of what I've just started getting into is cognitive longevity. How do I make your brain last longer?
Yeah.
And that's a whole subsection of longevity medicine, which is.
Yeah, and people don't think about that. They think about the physical, but they don't think about the mental. And there's no point in having the physical if the brain doesn't work.
One of the docs that was lecturing, he made a very good valid point. He said, cardiologists are great, right, for making sure you don't die of heart disease. But they really don't care if you're 55-year-old in a bed with diapers,
Yeah.
traveling away with dementia. They don't
Yeah.
really, of course they care, but they don't care. It's out of their form.
And who wants a long life if there's no quality? Yeah.
And most people.
Most people feel that way. So where do you see the future of this going, the precision medicine? Because obviously now one of the great things about all these tools is you're collecting data on people. And obviously as AI advances, the more data you have, the better.
Yeah.
So what do you think the future is?
Well, so the one thing, just to take a step back, the safety factor, we are collecting data. It's completely anonymous. You
Yeah.
get a number. The lab doesn't even get your name.
Yeah.
Okay. So this isn't 23andMe, and it's going to come back if the company. But it didn't, and it picked up a couple of weird genes, right? Like one of them is maple syrup urine disease, right? It's a weird disease, and there's some kidney problems. But again, all it said was, well, you got this, on with you. So it's like, well, but I'd like to know, is it something I got to worry about? Something I can pass on to the kids, right? So where it's going to go is I believe you're going to be able to come in with a disc or a fob or something with your genetic code, at 350 pages, and say, listen, I want my annual checkup. Now, I do a pretty deep dive on people, and we do some really interesting testing, not only here, but abroad. A lot of my clients will go to the US or even Canada for specialized testing if they're so motivated, right? There's cancer screenings that I do. There's whole body MRIs, all these, deep dives. Well, I think what's going to happen is I'm going to put this into the system, right? Upload it to the system, and maybe before your visit, right? Now, I'm going to, what are your complaints? What are you doing? Blah, blah, blah. But I might say, these are the 4 things I'm concerned about. And then my partner, the AI, is going to say, yeah, but risk stratifying, you really got to worry about prostate cancer because it's an issue here. Look at these markers, right? So it is something that's amazing. And just my ADD's kicking in. When you're talking about prostate cancer, so here on Ireland, we push, get your PSA once a year for prostate. In my opinion, 1 PSA a year is pretty close to worthless. What we like to do in the office is we like to get it 3 times a year and look for progression. Right?
Yeah.
But the other thing is we also use ultrasound to look at the prostate. It's painless. It goes right through your belly. Guys don't have to worry about the finger up the bum. They get all, happy about that. But the cool thing is I bought this ultrasound machine. Literally within 6 months, they said, in a year, we're going to have an ultrasound wand that's AI directed that will read it in real time. So I'm looking at it. Now, the human error would be, all right, I'm measuring. Well, maybe I'm off a little bit or I don't see everything. The AI is going to read it. And that's been shown, like Google just put out an article that they completely blow away radiologists in every read, CAT scan, MRI, X-rays, completely better. Now the insurance company is going to come along and say, well, what do we need that for?
Yeah.
Now, interventional radiologists, yeah, you need them to do things.
Yeah.
And the rule of thumb is, in medicine and everything, if you don't touch a person in your day-to-day, your job is at risk.
Yes.
That's an easy way to explain it.
Great. But the whole of humanity will benefit because they will have access to.
Except what are they going to do?
Yeah.
I was thinking about this yesterday. Did you ever see that movie, Wall-E?
Yeah.
I said it's about 15 years old.
Yeah.
Whoever wrote that movie was a
I
real
had a
forward.
time. Yeah.
Because that's really I mean, look, it showed the kid, and Wally was this obese kid. Oh, yeah. Obese.
Yeah.
And what are they doing? They're just sitting there, they're not doing anything, they barely walk.
Yeah. Yeah.
That kind of thing. So,
Yeah. So what about the cost element? Because this is something that I think about a lot. So to do something like this currently, obviously it costs a lot of money,
Yeah.
and it's ring fenced for the people that can afford it.
Sure.
But one of the big things is I believe in 10 years' time, this should be available to everybody.
Sure.
And so what do you think about that?
I mean, it is costly, but like I said, it takes a number of not only hours but days to break this down, and they've invested millions and millions, and they got to recoup their money.
Yeah.
But this isn't one and done. In other words, your genes are not going to change.
Yeah.
So test them now, test them later. Sooner or later, you should test them. But the fundamentals of finding something that are astronomically, life changing, there's no price on that.
There's no
right. And so I do tell everybody now this particular test is broken into 4 sections. One is the autism learning one.
Okay.
So it's more for kids or maybe adults that just feel like
They need to
something's wrong,
yeah.
right? Then you have the brain one, which is basically Parkinson's, dementia, different vasculitis. So that's section A. Section B is your body. So if you're concerned about different modalities, diabetes, high blood pressure, everything we're talking about. And then the last section, the third or fourth section, is it's mind, body, and soul. How can you have anxiety? How can you have depression? Are there things that you can do naturally? I have plenty of people that come in and we talk about, like an SSRI for anxiety. And they're like, well, I want to do something natural.
Really?
This will give you that natural approach. Now, is it a solve-all? No.
But it gives you I don't know any other test that does that.
No, you can get serotonin, dopamine, norepinephrine levels.
Yeah.
The problem is they're not really effective because they change minute to minute.
Really?
If you are absolutely frightened
Then it will.
of your blood test being done, your numbers are going to be all
Great. Do you think these will eradicate diseases eventually as they get more intelligent with personalized medicine?
Yeah, I mean, I think the things you'll see, and there's again, you can you really can get deep dives into this stuff, but or rabbit hole of this. But the reality of the situation is, you're going to be able to develop drugs a lot faster, and realistically without animal testing, which is being the sort of
That's
animal
right.
lover, that's a good
That's
thing.
right. Yeah.
But the other thing is you're going to be able to find drugs quicker, faster, and they'll be able to really make it. You
Yeah.
don't really need a human to make it.
Yeah.
And as far as eradicating disease through medication, yes. This particular genomic test, for example, this is starting that process on prevention, maybe. Is there going to be, like the whole thing with longevity is, I like to say, I want to maximize your biology. We cannot change your biology.
No.
No matter what people think.
Not yet.
So I think that all of that is true. I think it will help with drugs. And then there's, not only quantum physics and all these other things that could do things even faster. And it's quantum physics is a whole nother thing that I just, I'm fascinated with. But there's different types of calculations that can be done so fast. It's
mind blowing, isn't it? It's mind blowing. Okay, so thank you for that. I mean, I'm massively interested in it, so it's really great for me to hear that. Find you just.
Grand Harbour Medical, right behind. I always like, but right behind the pharmacy, Hurley Shopping Center. We have a good amount of signage out there.
Yeah.
And Grand Harbour Medical with a U, we do it that British way. Grand Harbour Medical.
Proper English.
And always give us a call. Talk to my AI as of tomorrow. As of tomorrow, the 19th or so, or even maybe Monday. So the 20th, you could talk to Wendy. And if nothing else, even if you don't make an appointment.
Yeah, just give her a call.
Just give her a call.
Thank you so much. Have a wonderful day.